Well, good morning. Thank you so much for tuning into K24 this morning. Shiko Kaitani here with you. Really happy and blessed to be communicating with you from our studios, as we always like to call them, the Communication Center. Thank you as well for what we are receiving on our social media platforms as usual at K24 TV on Instagram, Facebook, as well as X is how you can interact with us. We are definitely looking out for you as well on WhatsApp. We changed our number just to give you a heads up in case you didn't know. There you have it at the bottom of your screen. Karibu sana if you wish to contribute to our discussion today. All right, ladies and gentlemen, it is World Asthma Day. Yes, indeed. It is actually marked on the the first Tuesday of May each year. This year the theme is Asthma Education Empowers, and so we decided to put a different twist to it this time around and focus on alternative medicine and how it can help one deal with their level of asthma. Very many of us here in the 254 in Kenya simply refer to this as, herbal medicine. We call those who practice it herbalists, but there really is a discipline to it. And so it is naturopathy or naturopathy, depending on which group of schools you went to. And so we do have a specialist in studio in this particular field. He has been here with us before, so he's not a stranger. Dr. Richard Saningo is here to actually talk about natural remedies for asthma this morning. Dr. Richie, welcome to the show.
Thank you very much. Thank you very
much. Good to
much.
see you again.
Thank you.
Yes, and clearly we are not aging. It's all the natural stuff.
Well, aging must happen, but we must delay it. It is possible to delay it.
Right.
Don't accelerate it. And so therefore it depends with our lifestyle today, because everything all around us is seemingly almost against life. And so we've got to understand the rope and how to be able to go about it.
Fantastic.
And demystify some of these beliefs.
Around it. We'll talk a little bit about your field, at some point in this discussion, but thanks a lot for agreeing to tackle asthma with us. We need to understand what it is before we start talking about how to deal with it. So from your definition, explain it to us.
Well, my definition is the real definition for asthma. It has no two definitions, whether you're looking at it from the alternative way of dealing with it or the conventional way of dealing with it. Asthma is asthma. The disease doesn't change. The scientific background about asthma is the same. Asthma is a disease of the lungs. The lungs being congested. The symptoms are you have a tight chest, you can't breathe, you've got to find something to dilate. The normal way of dealing with it is that you're looking for something to help you breathe because you're unable to breathe properly. You have attacks, you have coughs. Sometimes, all this comes as a result of weather changes. Right now it's raining all over the place. It's cold. And so people have more attacks than usual. So asthma is a disease that is very common now, all over the place. And that's what we want to talk about it. So the definition doesn't change. It's the same in science, because science is science. It doesn't matter what approach that you're coming from, whether you're from the alternative way or conventional way.
Still the same.
Still the same.
There are different levels to it, and we understand that there could be a classification of severe asthma. So for individuals who have the severe version of it, what are we looking at?
It might be a little bit controversial here, because I want to demystify first levels, severity. Yes, it's true that there are people who have gotten to a point where you're on the red line. when you take the, there's a little gadget that you blow at the peak flow. Oh, this one is severe, this one is not. When you go to your GP or your doctor and the prescriptions that you're given, could be this medicine. Basically, is a group of medicines called bronchodilators. So that they are able to dilate your blood vessels to open up a little bit more, so that more oxygenated blood can go through, and therefore. So what happens is that the process of your lungs being congested is gradual. Why? Lifestyle. And I might be answering your future questions that we want to ask in future, but the situation about your lung, the capacity of your lung to take in the required oxygen for your body, for your size, for your height, for your makeup, depends on how much congestion is there. And where is this congestion coming from? And this is where you come back again to our profession. In naturopathy, you want to look at what is the cause. And therefore, once you remove the cause, then nothing is there to support that condition and symptoms again. The other approach on this other, this is mild, this is severe. The approach from that side is that, oh, you need this much of this drug, or you need corticosteroids in this level, or you need more bronchodilators in this. I'm trying to avoid naming those names because I mean it's not my line. But that severity, once you approach it from knowing the cause, then once you remove the cause, then the problem is going to go. And therefore, you can't say, oh, asthma is incurable.
And that's what they say, there is no cure for it.
It's out there in the media. I go Google, asthma is incurable. It's not true. I've often said here, if it can come in, it can go. But you must understand how it came in
the first place.
What is causing it? On this other side, you're being told, here, this is good relief very quick. And you're buying over the counter at all times. You're supporting a system. You're supporting a situation whereby you're feeling good, but you're being told, eat everything. Some of those things, you're being told, oh, you have a deficiency of vitamin D. You have a deficiency of vitamin A and C and all that. And you must take some milk. Because you'll find vitamin D in milk. Or you can take fruits and vegetables and all that. Even dried fruits are okay. You'll find sulfites there. You'll find you'll find casein in milk. You'll find all these things that will cause asthma. So on this other side, I'll tell you, stop milk. It's the cause.
Okay. So what you're saying is that, first of all, it's severe because of the choices we're making, and it progresses in some individuals over time because of lifestyle decisions.
Supported lifestyle decisions. And you're not being told, you're not being educated in that direction.
Right.
And so nobody's telling you, stop your favorite glass of milk. Stop how much sugar you're taking. Go for an alternative to sugar. Find the right alternative so that you do not increase your free radicals. You don't increase the causative agents that you are ingesting on a daily basis.
That are now making it worse.
Yes.
And then, but you have to agree, obviously, when now there's the case of a virus, for example, the situation is extremely aggressive. So someone who's asthmatic, getting a cold, catching a flu, I mean,
it's terrible. Because one, you must understand that once you're deficient of getting the right amounts of oxygen every day. When you're breathing 2 liters of air, you're not using all that. Most of it is coming out and used up at the level of the alveoli, which is the very last little sac in your lungs where the exchange happens of oxygen and carbon dioxide. When a person that doesn't have asthma breathes those 2 liters, uses most of it, at least 75–80% of it. But when you breathe the 2 liters, you're using about 15 to 20%. That's why you're short of breath all the time. And you need to have a bronchodilator to open up so you can get more oxygen being used up in your alveoli. But right there at the alveoli level, there's so much mucoid matter, there's so much mucus. So where is this mucus coming from? And then, you just got a virus from a cough from Dr. Soningo. You passed by and he had and then it rained, so pneumonia.
Homa, nene.
Your immune system is low. It is on a forever low. So your leukocytes, the members of your immune system are on a forever low. So the attack system is difficult. So you get into a complication. You have to go to hospital. And you're hospitalized, and then oxygen and all that.
So you're compromised from day one.
Compromised. So on the other side is understand right from the beginning. Where do I get my vitamin D if it's not from milk? And milk is the one that is causing more mucoid matter and allergens that I'm getting from all the foods that I'm not being told to stop.
Still contributing to the build-up
So
of that.
it's a catch-22 situation.
Yeah.
And then again, because of your habits, you like having your chicken. You want to have your meat all the time. Nobody is saying stop this, stop that.
You want to have a cigarette here and there.
You still want to smoke a little bit. I want to have my wine.
Yes.
And sulfites are there as well. And
which are contributing to that matter.
Sulfites contribute to mucoid matter formation. So that phlegm right inside in your very end of the gaseous exchange level in your lungs is compromised. So stop bringing in all this stuff that is causing you to have severe, then you're
now classifying yourself
as severe asthmatic case, which needs this level of medication. So more money.
Pumping yourself up with more drugs.
Catch-22 situation.
So
once you understand this game, and you know the means to remove this phlegm and cut the tap, close it, of bringing in more of this, and you embark on a diet that brings in more antioxidants, which have more electrons to supply into your system and revamp your immune system, then asthma becomes a story of long ago.
You know, one of the interesting things I like about talking to Dr. Richie is how he simplifies all of this and reminds us that our bodies communicate to us. So it's telling us something. You need to stop bringing in the toxins that are causing whatever it is in our bodies. So that's where we need to understand. If you can understand how it's coming in, it can always get out.
Let me put it this way.
Okay.
I can get cancer not cancer, even that, but I can cause to have have asthma in 3 weeks. I can bring asthma into my body. I can cause it by indulging on the very wrong things all the time for 21 days in Mfululizo. And then I am unable to even cough, and then I'm carrying my But it will take me 3 months to get out all that phlegm that I brought in.
Okay. And so let's then now try to understand it from childhood asthma. Because here we have, you've got your child, you're not necessarily exposing them to the worst diet possible, and so you find very young ages actually contracting that asthma. Daktari, how does this come about?
This is very, it's $1 million question. Children don't choose what they eat. You choose for them. And it starts at breastfeeding level.
Oh, really?
The quality of your milk that you give to your child depends on what you eat. If you have 3 mothers, one is on uji, mfululizo, white uji, refined carbohydrates, and milk, and meat and chicken, a little bit of vegetables. Another mother, she's on a lot of whole meal. Instead of refined vegetables, anakula the right whole meal, mucus-free food. Another mother is on a lot of raw vegetables, juices, fruits, and grains, a balanced diet, no mucoid matter. The quality of that milk from those 3 mothers is completely different.
Really?
Really.
So this is not an environmental factor situation
Nonsense.
where my child could just simply be reacting to the environment that they're in.
You don't catch asthma like the way you catch a cold. No. You create it. Let's cut this chase. You create it by your lifestyle. So by the time you're 5 years old, your mother and your you were born in the first place, your gestation period, the 9 months, your formation. Your mother has been feeding on junk, chipo, mandazi, chai ya maziwa mingi, sukari tele. What is forming? You are forming your susceptibility. You're already having a lot of mucoid matter in your bloodstream, which you're receiving through your umbilical cord. Ukitoka, tayari viscosity ya damu yako sio the same na ule mama ambaye chakula yake ni balanced diet, anakula lots of salads, matunda mingi, kama anatoka Ukambani anakula maembe kwa wingi, badala ya kwenda kukula ugali ya mfuko anakula ile ya mudhokoi. You know, the difference between those children when they are born, this one is already healthy, the other one is being rushed to pediatric
ward ASAP,
and the other one is having good. Anatolewa nje, anapata vitamin D na short rays of sunshine mapema, ule mwingine ako. This other one is already having issues, having drugs coming in
already.
Branula is already there by the time they are 8 months. We cause these things without knowing, so it starts far away. So by the time you're getting to be 5, you're already on a lifestyle path to cause mucus, form mucus slowly by slowly. Another one is in an environment where the viscosity of that blood is clean. A balanced diet, it doesn't matter whether you're poor or rich. It's understanding of the food chain, what you're consuming right from the beginning.
Okay. Dr. Richie, let's take a short commercial break, because when we get back, I want you to expound a little bit more on that. He's definitely challenging us this morning, isn't it? That's a very bold statement. Mommies out there, what are you consuming that could be contributing, FYI, to your child's asthmatic issue? And also, like he said, what are we selecting for them? You could be actually making it worse. And so getting down to it and understanding the food process is what Dr. Richie says is where the secret is. Do you have a question in regards to these natural remedies or alternative medicine in dealing with asthma? You've got a child, or you yourself, by the way, actually dealing with asthma. Throw your question to Dr. Richie this morning through our social media platforms. We dare you. Ask them. And let's understand what he can do for you today. All right, we'll see you on the other side. And welcome back to Health and Wellness with me, Shiko Kaitani. We are marking, or at least joining the rest of the world in marking World Asthma Day this Tuesday. And this time around, we're talking to you about natural remedies for asthma. We do have Dr. Richard Saningo in the studio with us. He specializes in the field of naturopathy and, of course, talking to us about more of a different lifestyle approach to solutions to these kind of issues. Lifestyle changes is what he's challenging us on this morning. And before we actually take a look at your feedback, Dr. was telling me how, by the way, people just refer to him as a herbalist.
Which is okay.
Which is okay, right? You know, people are like, no, herbalist, aliendanga wapi. But there's a field, ladies and gentlemen, to this. There's actually the science behind it. It's a discipline, and he'll be talking to us a little bit more about what he does towards the tail end of the show. But speaking about asthma, Dr. before we took that a commercial break, we really wanted to also just throw in the aspect of asthma attacks. You know, people understand the, you know, the point at which, fine, something's flaring up, it gets a little bit worse. But what are we literally looking at when someone says, you know, they have an asthma attack?
Yes. An asthma attack basically is where your airways are constricted to a level that you are actually cutting out oxygen entry.
You're suffocating.
You're suffocating. You're trying to breathe in, but it's not going in. Say, I need air, but it's right there, and you're not getting it down to the exchange level. Remember I talked about the alveoli level? You've got to a point where you've concentrated the percentage of the phlegm or the mucoid matter within your lungs is a lot, and you're not able to cough it out.
Yeah.
That's when you have, it's life-threatening.
It is life-threatening.
And that mucus does not just reproduce by itself.
It's taken time.
You brought it in on a daily basis. I tell you, Kinyanjui, wacha kunywa maziwa. Say, ni kunywa nini? Sasa what will I? Stop taking sugar. Say, but ni tamu daktari. How do I, then what do, I can't find honey. It's expensive. So anyway, the other angle I want you to look at is every asthma patient has certain parasites. Human beings can harbor over 216 parasites in the human body. In your lungs, in your kidneys, in your liver, in your brain. There are brain worms. There are heartworms like spaghetti. There's practically parasites everywhere in your body. How do they come in there? Lifestyle again. How you eat, what you eat, and when you eat it. And so your severity of your asthma, you can have 10 people with asthma. One is very severe, another one is just
it's even
on
occasional.
The borderline. It's occasional when they take a certain allergen without knowing that they took, and they're allergic to that allergen, or weather conditions have changed, the temperature has gone down. What happens is that we forget that we are chuma. We're made of iron. When you're low on iron, your blood is low. And so when there's cold, what happens when you cool a metal? It
contracts.
Yes, and what happens when you heat it?
It expands.
So when there is heat on us, blood vessels will expand. Your blood is expanding because there's iron in us. So when it is cold, very cold, you constrict. And when you constrict, you already have a lot of mucoid matter, which is lining up your blood vessels, and you have a lot of plaques and all that. And so you start having deficiencies of oxygen levels in your blood. And so therefore inakuwa kidogo. So you start having heart attack. I want more air. when you feel warm, you get heated up, you're like,
because the lungs are saying, yeah.
Yeah, because more oxygen is coming in.
Okay.
Sometimes you have to do that by a drug, with a drug. A molecule that will cause you to expand by force.
Which is what the inhaler does for you.
Steroids.
Okay. So this
and the inhaler is, most inhalers are
steroid based.
Yes.
So let's understand why it's so key for asthma patients to always have this life-saving gadget in their pocket.
It is very important for you to understand that before you already are in the space of being asthmatic.
Right.
You cannot remove all this phlegm at a go.
Right.
So what do you do to save your life? Have that saving gadget. Get an inhaler, walk around with it. When you have that, use it.
Yeah.
But wait a minute, for how long? Now that you understand that there is something I can do to reduce the amount of that demon that is attacking me.
Yes.
Cut the path. Weka nyuki. Weka mikakati. Panga. Tafuta.
Okay.
Next week, apana kula. In 2 weeks' time.
Yeah.
You've not eaten the things that is continuing to add your phlegm level.
You will see a change.
You will see a major change. You will not need that inhaler as often. And as time goes by, look for Dr. Saningo. Get medications that will continue to remove this mucoid matter as soon as possible and faster.
Yeah.
And then more advice on A, B, C, D. How do you kill these parasites that are living in your lungs? Kill them so that they do not produce more of these chemicals that are also contributing to mucoid matter formation.
All right. Dan, let's take a look at text messages. I know that we did tease this particular topic on socials. And by the way, you're still welcome to text in ASAP before we wrap it up. Dr. Richie is challenging us about what we're putting in our bodies. Gideon, thank you so much. Hi, Shiko. Caught this teaser on IG. My question would be around studies indicating that negative responses to emotional stress cause attacks. What are some natural relaxation remedies? Okay. By the way, do people get attacks because of stress?
Yes.
So the mucus matter, stress, we're trying to see the correlation. Yeah.
Simple. On a good day, you have narrower airways because they're already lined up with mucoid matter.
Okay.
On a good day, no bad news, no stress. You're just barely working on 40%, 30% of oxygen levels, while you're supposed to be running on 75, 80, 95, 100%, okay? Then quarrel comes, stress comes, bad news come. What happens? Remember, we are hormonal, we operate on chemical messages.
Well, right.
So your endocrine system is dependent. You're dependent on your endocrine system because we run everything through a hormone. It takes a hormone to think, a hormone to see, a hormone to sleep, a hormone to digest, a hormone to breathe. So information comes that is negative emotions. First thing is adrenals kick in. Yeah. Produce more cortisons. So stress comes in. I mean, you respond to the cortisol levels in your body. What do? They make your blood vessels constrict more. You already constricted. So now it's worse. So it becomes worse.
So you start having a panic attack. Yep, exactly. Asthmatic attack is kicking in. Yeah, yeah.
The same message comes to someone who does not have. They'll have probably a little issue about chest pain or
shortness of breath, but that's it.
Yeah, but not life-threatening. For you, you already working on you're working on a space where you don't have enough blood vessel or space, or the airways are already constricted, and so you're on a low. So once you cause the fright and flight situation of adrenaline and all, what happens? You get more constriction.
You're triggering.
and you already have little space than the normal person.
Okay, so what would be the remedy there? I mean, because he's talking about some natural remedies to dealing with that stress for people who are asthmatic.
Depending on what stress it is, understand relaxation methods.
Okay.
Deep breathe, in and out, meditation. Some people call it yoga, Christians call it meditation.
Yeah.
Same thing.
Okay, same thing. I like it.
Hot water bottles, if it's at night. Hot water, a very simple thing. If you're in a space of putting water into
a bucket,
most of the time, your feet are cold. The asthmatic person has got cold hands and cold feet. Our extremities have got the largest blood vessels.
Okay.
When you have congestion in one part and this blood is not going to other areas properly, you have attacks. When you heat up the lower extremities, blood rushes up because you're expanding blood vessels there. So there's no vacuum that can be caused inside of you. So when you're expanding the blood vessels in your extremities, blood rushes out there. So you balance out your circulation. Panic attack in a coalescent. When you're in winter countries, I remember we used to put cayenne inside socks and you wear socks.
Oh.
And you can go on a -17.
Really?
On zero. And you have a t-shirt.
Yeah.
Why? Because your feet are hot from cayenne inside the socks.
I've never heard of that. Oh my goodness.
Yeah, you've not lived through a winter, have you?
No, I haven't.
You don't have winters here. So when you heat the target is to make sure your blood vessels are opening up in your extremities so that you do not have congestion in your abdominal or thoracic area.
Okay, okay.
So the natural ways, there's quite a number of ways. So it's make sure your blood vessels open up. So if you're using hydrotherapy or water, a hot water bottle or water compress or whatever way you're trying to heat up so that you're not, understand the signs of constriction and expansion.
All right. Let's look at another one. And thanks so much for that, Gideon. I hope Daktari answered your question. JJ in Mombasa says, my small sister has asthma and we continue to try all sorts of ways to suppress the symptoms of her asthma. Kindly ask Daktari if diet can play a role in easing asthma symptoms. Thanks. Always a fan of the show. Thank you so much, JJ. I think that was already pretty much answered.
JJ, we talked about this.
We've talked about this.
But nevertheless, yes, that does a very big role.
Okay.
JJ, get in touch with me. I will send you for free our diet plan for asthma patients. And your sister will be able to get it right.
Wow. Okay. There you go, JJ. Let's see the next one, Tafadhali Dan, because we only have about 10 minutes to go. Laura going on saying, I have always been a big supporter of organic healing. I believe our bodies can heal themselves if we follow proper dietary standards and lifestyle changes. Why aren't doctors such as Richard promoting themselves more? Kindly bring more shows on natural healing. Challenge to you, Daktari. Why are you herbalists not promoting yourselves more?
Is it challenge to me or challenge to Shiko?
I brought you here today.
Thank you. So ask for more of this. We will come in. I mean, I've been doing health shows for so long on different media houses. But yes, thanks for the challenge. We'll do a little more. Understanding our body in totality is very important. I always say this. People understand their gadgets more than they do understand their body. You understand your fashion more than you understand the inside of your body. You understand your car more than you understand your body. Seek to understand how this vessel runs so that you don't put fuel on the radiator and put water in your tank.
Yeah. Correct.
That's what we're doing. You eat the wrong things the body doesn't need. You put in more junk and then you start dealing with symptoms.
Yeah.
What do we do to alleviate the symptoms? Remove the cause.
Right.
Yeah.
So we are highly dependent on big pharmacy for our solutions, yet we cannot deal with the primary issue.
And that's why even on another show I said here, let's go back to settings.
Yeah, factory settings.
Factory settings.
Yes.
Rudi uko chini, foundation, find out what it is this body really needs. This story of wanting quick fix.
Yeah.
Well, in times of emergency, because you're already there and you need it, we will find a way to get this emergency out of the way. But make sure you go back to settings. Take the right things for this body, and it will not let you down. And there will be no incurable disease for you.
You've kind of highlighted, and even in response to JJ, that there are those dietary options, natural remedies that you're willing to even recommend.
Yes.
Well, give us a kind of like a preview to it. Like, what exactly would you be doing for an asthma patient step by step in literally 1 minute before we say Kwaheri?
In 30 seconds.
Yeah.
First, take away the wrong things. Number one on the list, milk and sugar. Cow milk, go alternative milks. There are so many choices these days.
Right.
Go alternative sugary.
Okay.
That aside, that is a major thing. There are many others, sulfites, nitrites, amphetamines, all those things. And that's why I'm saying I'm willing to give people for free information. Get in touch. Then once you remove the cause, which is daily coming, deal with the situation right now. If you have to take a bronchodilator, an inhaler, and for the time being, it's not a sin. Do that for the time being as you continue to deplete the mucoid matter, kill parasites.
Yeah.
That you need to see Dr. Saningo about it. Get the medications that kill the parasites and remove what? The mucoid matter. What foods are best? Go plant-based foods. Plant-based foods.
Right.
And avoid refined foods. That's basically in 30 seconds. But in details now of what plants are best, how to do it, those are details.
Those are details. All right. And of course, that's why he's here, so that you can see him about the details. As we start to wrap up, I'm just going to ask you what more needs to be done to kind of support doctors who are in your field in this country and also increase public confidence in naturopathy, Dr. Richie, because it seems that alternative medicine, natural remedies, it's such a huge, huge industry in the Western world, but it doesn't seem to be trickling in to Africa that fast.
During the campaign trail of the present government, I remember hearing His Excellency Gachagua saying that we will revamp alternative medicine in this country.
Right.
And I was very happy because then we may have legislations that will be able to put these things in the right direction.
Right.
There are experts in this country who get very frustrated because there are no legislation frameworks that help alternative medicine practitioners in this country. Even if you're a scientist at a level where you are able to put these systems like there are in Germany or France or Americas or various places that have developed this, there's nothing. You can't do it. For example, my patients can't pay me through insurance because insurance in this country does not pay for alternative medicine.
They're like, we're not supporting these herbalists.
So it has, So first thing, this government had promised that it is possible to enact laws that are not draconian. Let's go with the times.
Okay.
Why is China, Thailand, the Eastern Tigers in Europe, why is it that it's so developed? Because there's support from government. But there's a lot of politics in it anyway, that because I've been in it for quite a while now. We just need to streamline this in the right direction. Okay.
As we're saying, Kwaheri, very quickly, how can people get in touch with you, Dr. Richie, so that we can say goodbye?
2 numbers, very quick. 0722 770 604. Another easy one to catch is 0733 282222. Am I allowed to repeat?
Yes.
0722 770 604 or 0733 282222. Once you call that, SMS, WhatsApp, you will get. If you want my email, drsaningo@gmail.com.
Fantastic.
Thank you very much.
Thank you so much, Dr. Richie, there coming to speak to us about alternative medicine, and in particular when it comes to asthma, what can be done. For further consultation, he's giving you those contact details. Thank you so much for watching. Let's leave it there. I'm Shiko Kaitani, handing over to Sarah Ibrahim, coming up next, as well as Tony on Interactive. Have a blessed day. Bye-bye.